Hello friends, welcome to the very first episode of Ask Leah, a monthly video series created in collaboration with Leah Hemming of Hemming Sexual Wellness Clinic as part of our Areas of Sexpertise project. Leah is a seasoned nurse practitioner with over 20 years of experience, and she is also a certified sexual health counselor. So the Areas of Sexpertise project consists of a monthly column that kind of dives into a specific topic a little bit more in depth, and that is written by me, Aspen Gengenbacher. And these videos will be more of a Q&A approach using questions submitted by readers. So if you have any questions, you can submit those to us, and we would love to answer them on the next episode of Ask Leah. So we received a lot of really interesting questions for this first round, so we'll go ahead and get started. I think I put more of the straightforward ones first, and then we'll get into more of the wider answers. So the first question, how should you handle it if a guy truly doesn't understand that you don't want sex but keeps trying to convince you?
Oh, that's a really good question.
Mm-hmm.
So how do you handle it if a guy is trying to pressure you into sex and you're not interested?
Mm-hmm.
Well, you'd have to kind of know the context of it. Like, is this the person that you feel comfortable with, comfortable having a conversation, or is it kind of a one-night stand situation? But ultimately, you are the gatekeeper of yourself. And so what you allow to happen is, how should I say that? You have to be your own advocate. So if something doesn't feel right, you have to stand up for yourself because nobody else will. So understanding how you want to receive information is how you should probably consider start giving the information. So maybe have the conversation when some of the emotions are taken out of the context. So for instance, if I'm talking to someone, or if I'm trying to explain something to someone, you want to kind of put everything into context when it's happening. So basically, I'm not going to teach you about fire safety while your house is on fire.
Right.
So same thing, I'd want to have a conversation with the person that I'm going to have intercourse with prior to the actual act. And maybe the conversation needs to be had with yourself first. What will I allow? What will I not allow? And then the more you practice it with yourself, then you can start practicing it with the people that you're going to be doing that act with. So maybe consider not having that conversation right at the moment, and then have it beforehand. So like preparation. So planning to fail is failing to plan, or something like that. But anyway, have the conversation when the emotions aren't so high for that activity. If that makes sense?
Yeah, for sure. This one is interesting.
That's a great question.
Yeah, for sure. I think that so much of it really depends on your communication, and like you were saying, setting boundaries with yourself is probably a really good way to practice your boundaries with other people, I would think.
Yeah, communication is the number one top universal kind of sexual health rule. Communication, that provides opportunity for consent, that provides opportunity for discussions of what is on limits, what is off limits, what are hard stops, what are soft limits, as far as everything. I mean, the world revolves around communication. That's where most conflict happens, is failure for good communication. There's a phenomenal book that my employer kind of adopted years ago. It's called Crucial Conversations. It has transformed the way I speak to my children, to my spouse, to patients, to clients, to anyone that I meet. Crucial Conversations. It is phenomenal. It's available on audiobook. It's available on old-fashioned book. It is. They teach classes on Crucial Conversations. It is phenomenal, and it's basically you lead with a fact and how that fact makes you feel. So the fact in this instance is the person is feeling pressured to do something that she's not interested in, and that's the fact that she feels, and then that she is presented with, and then follow it up with how it makes her feel. And then, because nobody can argue with how something makes you feel.
Right. This person asks, do pubic hairs get longer the older you get? Because that's happening to me.
Well, that's interesting. I don't know the answer to that. I would assume it's like hairs than the rest of your body. If it's not maintained or cut, it still keeps growing.
Right.
So that's a great question. Sometimes as we age, pubic hair goes from curly to straight, kind of loses some of the elasticity in the hair, follicle, or not the follicle, but the actual piece of hair. So I would assume, but I can't.
So it could just be a straightening rather than
and
a
losing some of the
lengthening.
curl.
Okay.
Yeah.
Interesting. I did not know that.
That's a great question.
Yeah.
And I think that some of that is dependent upon your diet and your lifestyle too. But that's a really cool question. Thank you for asking that, whoever asked that.
This next question is really, really intriguing. My partner is taking a libido-inhibiting drug for mental health reasons. Do I live an intimacy-free life or plead for my partner to change the drug? I have expressed my concerns and feelings, but they stated their mental health supersedes my desire for intimacy.
Wow, that is beautifully stated, and that is probably one of the most common causes of distress that I hear in my clinic. So basically, one partner is on a antidepressant or anti-anxiety medicine. Typically, it's an SSRI, selective serotonin reuptake inhibitor. Those are known for causing suppression of sexual desire in some of them. And the other partner who is not on the medication still has what they consider is a non-suppressed sex drive. Okay, that's what I'm getting from that. Okay, so that's very common. No one should live unhappy with where their life is right now. So this is a perfect opportunity to have a conversation with the two partners, which is why in my clinic I prefer both partners come, because I kind of always say it's like teaching a doubles tennis match to just one partner. So a lot of times it should be shared because it is a combined act for the most part in this situation. So that's a two-part story. Number one, mental health is super important. So that person, they have to have the shared discussion on the level of importance. So you would have to know the person taking the antidepressants or the mind-altering medication, where are they at with their mental health? So do they consider it healthy? There's two main parts to mental health, and I'm not saying that exercise and nutrition and all of the things and sleep and vitamin D and all of those things aren't a huge part of it, because it is all connected. But number one, are they taking the medication at a dose that is appropriate for them? And number two, are they also going to behavioral therapy, so like counseling? So anytime I prescribe a mind-altering medication, I also follow it up with counseling, because it would be very much similar to me saying, here's some insulin, but I'm not going to teach you about changing your diet to how to get your blood sugars lower. So just prescribing a mind-altering medication is only half of the puzzle. The other half is talk therapy, behavioral therapy, psychotherapy. So just to kind of make sure both of those aspects for treatment are being addressed, and then seeing where that person is and their mental health wellness. Are they comfortable enough to consider a mind-altering medication that doesn't come with those risks? There's certain antidepressants like Wellbutrin, for instance, causes the lowest amount of sexual side effects. In fact, Wellbutrin has been associated with spontaneous orgasms. So that is something to consider. But if that person is very pleased and stable with that medication, there's tons of interventions that can be done to increase desire in that person. And again, it kind of leads to communication, and that's going to be a common theme in most everything that I say, because what I'm doing is communicating to you, and communication is lubrication. Communication makes the world go round. And so in politics, in healthcare, in friendships, in family, in everything, it's a strong communication. So kind of discussing goals, maybe establishing if if the one partner is not interested in changing medications, and maybe their desire is so low that they're okay with what they have going on, then maybe we establish with the other partner, is self-pleasure okay? Is self-pleasure right next to you okay? Are you comfortable with joining in self-pleasure? You know, is this person that's taking the medication, are they happy where they're at? Is it causing distress in them that their partners have that they are at a mismatched desire kind of crossroads? So it's not cut or dry, or black or white or whatever you call it, but is there a level of distress to the person that has the low sexual desire? Obviously, we know there is a level of distress to the person that's asking the question that's not on it, but we have to know the level of importance, because if something is of importance, you'll put extra effort into it. So,
One.
Okay, this next one is, what are the most commonly spread STDs and STIs in Quincy?
Oh, Quincy. I don't have statistics for Quincy. I am based out of all of Illinois and all of Missouri, so I don't know that. But I believe you can go on the Adams County Health Department probably and see that information. I can tell you the most widespread across the U.S. is human papillomavirus, HPV. It is a virus that most everybody has been exposed to at some point. Very similar to most viruses, and our body's immune system does a really good job of kind of taking care of it on its own if you have a healthy immune system. But HPV, we do have Gardasil, which is a vaccine to protect us from developing HPV-associated cancers. That's a great question. HPV is the most common type of sexually transmitted virus, and it is specifically one that occurs in 99% of head and neck cancers, 99 to 100% of cervical cancers, tonsillar. So yeah, HPV, and you can have people that have been exposed to the virus. It kind of stays dormant in their bodies, and then it can resurface after or reemerge. As you know, your age advances and your immune system is kind of compromised through medications or illnesses and chronic diseases and stuff, the HPV can reemerge and kind of wreak havoc in your life at that point.
Jeez.
Yeah.
That sounds terrible, but so many people have it. Yeah, and we have a vaccine for it.
Yeah, and screenings for HPV are started in pediatrics, and we want to get it started before the child has been exposed to the virus.
Right.
And you know, it's been a hot topic of controversy for years since it's been out. But really, once the child has been exposed to HPV, you're kind of chasing your tail. And there's several different forms of HPV, forms of the virus, and so the vaccine covers the most common forms, but nothing is foolproof. But it certainly significantly has decreased our HPV-associated cancer risk.
For sure. And if anyone is interested in learning a little bit more about cervical cancer and the Gardasil vaccine, HPV, there's an article that we did in January that has a little bit more information on that. So we can definitely link that below. The next question, we've got some vagina-themed questions coming up. This person asks, how to make your vagina smell better or more fresh? It doesn't smell terrible, but has an odor, and I just can't help but be self-conscious just doing day-to-day activities.
Nice. That's a very common question, too. I hear that a lot, actually. Our vulvas, vaginas, perineum, have a beautiful system of a self-cleaning system. We have tons of bacteria and viruses and fungus that live in our perineum that essentially acts as a dishwasher. So we have mucus that develops as a byproduct of kind of acts as like your lymphatic system for draining any bacteria that's not needed. And so that's oftentimes what makes discharge. There is a natural scent to every person, and it's often common. I know that there's a lot of wives' tales or messages passed along about pineapple juice.
That's what I was just going to ask about. Is there any truth to that?
No.
No? Oh, that's
No,
so disappointing.
There's no truth to that, but I really do think that most of us could get on a gut bacteria program, like a good probiotic. A lot of the foods that we eat have colors added to it that are not found in nature, and a lot of foods that we eat have texturizing agents that are not found in nature, and it disrupts our microbiome, our good, healthy bacteria that live in our bodies to protect us from illnesses. And our colony counts are very low because of the foods, the additives that are added to our foods. But as far as odor and drainage, if it is something that is new, like something, like all body parts have some kind of a smell, armpits make a smell, ears make a smell, our breath, our perineum. If it's kind of been the norm, it's likely normal, and if it changes, that's when you need to be concerned and visit your physician. If the color changes of your discharge, if it's no longer clear or kind of whitish, and it's more yellow or green or red, that's definitely concerning for a bacterial infection or even a viral infection. But an overall odor is pretty normal.
Gotcha.
And nothing to be self-conscious of.
I remember seeing something when I was in high school it was like a little oil, and I think it was called panty cakes, and it was supposed to make your vagina smell like cupcakes.
Oh.
So interesting,
Okay.
interesting thing that's out there. This person asks, how can I
can I add on
Yeah,
that?
for sure.
Making sure blood sugars are controlled too. So that's a really good thing to know too. If you're concerned, about smells or drainage or discharge, to maybe visit your primary care provider or your gynecologist so they can check out and make sure that you're not running a risk for insulin resistance or prediabetes or diabetes too, because you can increase your risk of infection by having uncontrolled blood sugars.
So it sounds like the best answer to that is more concerned with diet and eating maybe more whole foods, less processed stuff to keep that gut microbiome.
Yes, and that's kind of a blanket answer. If it's something that's concerning to you, peace of mind is going to trump everything. So go to your primary care doctor, go to, the whatever clinic you have access to, easy access clinic, and just get a once over and make sure all your labs look healthy, make sure everything looks well in there and no risks of anything, like cancers or viruses or bacteria or anything. But if everything pans out, I think we all could use better nutrition, especially in Illinois and Adams County, because we are the most obese state in the county.
We are? We're
Yes.
the most obese county in the state?
Yes.
Oh my God, I did not know that. Bob, did you know that?
I did.
That's interesting information.
Congratulations!
Yeah, go us. Oh gosh.
Drink my Starbucks.
Okay, this person asks, how can I lighten my vagina naturally? Is it bad that I want to? I know everyone is different, but I can't help but be self-conscious about it.
Lighten the color?
Mm-hmm.
That's a great question, and that is actually really common in adult film industry perception. But I don't know the answer to that either. Labias, the perineum come in every color. It's like saying, how do I get Aspen's olive color skin when my cheeks are always red? I don't know how to do that, and I don't know how to answer that. That's a phenomenal question. I know a lot of labiaplasty occurs, and we're kind of transitioning, and there's nothing wrong with that. I think people should change their bodies however it makes them feel most comfortable in their own skin. I feel like our traditional kind of how we view, because we're talking about labias, I'm going to say female body. When I say female, what appears to most people as females, But how a labia appears has been modified in the adult film industry. But a lot of that is either AI or touched up or professional bleaching. We have now more realistic pornography that shows labia in every color, every size, asymmetrical, just like it is in real life. But I'm not for sure. That's a great question, but maybe I would start with dermatology or plastic surgery.
It's a really interesting point that you made, though, about how a lot of that, I think, perception just comes from the adult film industry.
Right. Well, even if you were to look in a book, like a sexual anatomy book, or if you were to Google an image of labia or vulva, it is on a white female.
True. That's very true.
And it's pretty anatomically drawn.
Mm-hmm.
So oftentimes you don't see one labia longer than the other, or labia that comes down a little bit longer, or brown or dark colored or with moles. Like, you don't see any of that in educational material. So we are leaving out most other populations other than white females.
Interesting.
Or people that were born female.
Right, right. This person asks, I ran over my testicles with my Jazzy scooter. What should I do?
Oh, I would seek immediate medical attention. Again, I don't really know what a Jazzy scooter is. Sounds fun.
Jazzy scooter is it's a seated automatic scooter that many people with disabilities that affect their ability to walk and kind of transport themselves from A to B, they utilize a Jazzy scooter. Fun fact. I did not know that until yesterday.
Wow. So they got ran over. That sounds like a significant pain and potential for injury. Testicular torsion can happen. I mean, yeah.
Sounds serious.
Yeah, I would not just walk. I would probably run to the urgent care and get that evaluated.
Okay, that is all of the time that we have for today. But if you have any questions regarding, medical things that might be going on with your body, if you want advice on a specific situation, or if there's simply just a topic that you would like to get Leah's take on, definitely feel free to submit those on our 100% anonymous submission form. We'll link that below, and we will try to answer it on the next episode of Ask Leah. Thank you so much for joining us, and we will see you guys next time.